So, okay, just to clear up, because there's a lot in the Googleverse, what is the difference between a tummy tuck, abdominoplasty, and diastasis recti surgery? If you can
Yeah.
kind of break that down for us.
Yes. This is really weirdly messy. Okay. So there is something you can get. Let's say your actual diastasis isn't that bad and you just have a ton of extra skin. There's a procedure where you just get the skin tucked up, and they also call that a tummy tuck, but then people also call it a tummy tuck when you also get the muscle repair.
Okay.
So that's kind of weird. It's definitely more of a rare thing that you're just going to get the skin tucked up and not do the muscle repair, but it definitely can happen.
Right.
So I think technically that's the tummy tuck part, talking about the skin.
Right.
If you say abdominoplasty, then you're talking about both, but most people use tummy tuck to talk about both.
Okay, gotcha.
So it gets confusing, right? And then with the diastasis repair, sometimes people will get that repaired without touching the skin. Sometimes people will do the robotic repairs or, different things, or they don't have a lot of extra skin. So sometimes maybe they'll just call it that. Or some people are just ashamed and they don't like that. That word tummy tuck has a lot of negative stuff around it. Right. So some people will just call it a diastasis repair because they don't want people like judging.
Right.
So it's a mess.
Or mommy makeover, which includes the tummy and the boobs, yes. Right?
Correct. So yeah, that's the mommy makeover. Correct.
Right, yeah. Right. Okay. Thank you for clarifying that. And yeah, you're right. It's kind of muddy waters. It's not really a huge clarification because everybody refers to it as different terms, right?
Yeah.
Okay, so I know that many moms will, and I'm going to put some of your pictures here too, your before and after pictures. And I know a lot of moms who are here are probably thinking, okay, how do I know when it's like too bad? Like, how do I know how worse it needs to, or how bad it needs to be to get a tummy tuck? Like, when is it kind of like, and I know Lisa has done everything in her power. You saw the best physiotherapist or physical therapist you call in the US. Yeah, I know you flew to California and you saw some of the best Anthony and Grenier, who are in the research space of diastasis. So you've seen so many. And I know there's that, like, there must have been a point where all of you were like, okay, we've done all we can. Now it's time to consider, getting the surgery. So if you want to work that in, I guess that very open-ended question in with the 5 steps of what a mom must do before considering surgery.
Yeah. This is such a weird place because we've gone from, we don't even know what diastasis is, to people know what it is, but then there's all this weird information about it. Now everyone's freaking out and, and it's like, we need to kind of like reground that at the balanced middle. Before I go through my 5 steps, really overall, like, my hope for women is that they go into the surgery from a place of empowerment versus a place of desperation. Mm-hmm. So if they choose to get it only aesthetically, like functionally they're strong, but aesthetically like, then that's their choice. And like, let's do it. But I want them to understand the realities of the recovery and all of that as well. Because it's plastic surgery, there's a lot of lacking information about how to get back to fitness. It's just not there, right? Mm-hmm. So there's a huge disconnect, and not all the surgeons really even understand like what people want to be doing after surgery or how to guide them that way. So there's that. Also, because diastasis turned into this very fearful, scary thing, like, oh my gosh, I have 3-finger diastasis. I need surgery, or I have back pain. It's because of my diastasis, and all of these things. And so that makes it all messy as well, because a lot of those things can be mitigated. And like, even myself with such a severe case, I was able to do so much functionally. Mm-hmm. Yeah. And so that's a challenge with people. But looking at it from let's look at the diastasis itself. When you test diastasis, right, we can look at how wide your rectus is and then how far your hands go in, right? Mine could go in and touch my spine. And
I read that. Right.
So surgery for me, right? Now there's all kinds of things in between, right? Like going down just a little knuckle deep. Okay, well, yeah, you've had a baby. You can probably work on loading that and tensioning that more and getting that to be even more responsive and more strong. Is your stomach going to look the exact same? Even people look jacked after pregnancy. those people still say their stomachs don't look the same as pre-pregnancy.
Yeah.
So understanding, accepting that is the first part, but really that fascial tension is more important than where you are width-wise.
Exactly. Yeah.
Even me, I could bring it into here when I was doing athletic stuff, but then at rest it was here and my fascia, right? But I could, because of all my hard work and playing around with all these millions of things, right? So that's really what people want to look at from that standpoint. But even so, then it's like, well, does it go down this far, this far? Yes for surgery, no for surgery. I mean, it's messy.
Yeah.
So,
yeah.
And so that's what go ahead.
Everybody will have I want to spend a year trying to fix this the most natural way possible. And then, so everybody will have a different, I guess, kind of timeline as well. Which you're going to tell us what you should be doing before you get surgery.
Yes. Yeah. The timeline. Yes. So